Next, for anyone who's got long-term health needs but isn't in hospital full-time, the cost of all the care that's required can really mount up, especially when it comes to round-the-clock nursing care for the elderly. Now, in some cases, families have sold their homes and racked up literally thousands of pounds in debt to look after their loved ones. But as the couple in our next film found out, after spending hundreds of thousands of pounds to look after their mum, they might not have needed to fork out all that cash after all. Paul and Jill Pearson from the Wirral have many happy memories of Paul's mum, Kath.
My parents always had a canal boat for probably 40 or 50 years. Every single holiday was always spent on the canal boat, going as far afield as London on occasions.
Kath was my mother-in-law and she was fabulous. If we'd had a busy day at work, she would always come round and there'd be a casserole made that we could put in the oven for tea. She was as super a mum-in-law as ever anybody could want.
But in 2002, a year after the death of Paul's father, Kath was diagnosed with Alzheimer's, and the family took on the responsibility of caring for her in her home. However, as time went on and Kath's situation deteriorated, aggravating already existing mental health issues and depression, that became increasingly hard.
Life became very difficult for us as a family. We would be phoned up 50 times a day. That could be 3 o'clock in the morning, 4 o'clock in the morning. She stopped looking after herself. All of the standards that were typical of Kath just disappeared.
In 2006, becoming increasingly concerned at the level of help that Kath needed, and indeed concerned for her safety, Paul and Jill took the decision to admit her to a residential care home, where they knew that she'd get the attention she needed.
We got to the point where there was no other decision to make. We couldn't carry on longer. We knew she couldn't carry on longer.
It was a tremendous relief, to be honest.
But that still left the question of how Kath's residential care, costing more than £2,000 a month, would be paid for.
4 days after she'd gone into the home, we had a meeting with Social Services Funding, who went through her accounts, her savings, her home.
All the people, their real only asset is the house that they live in.
So we had no option other than to sell the property.
At no time were any other real options explained to us.
There was, however, another source of funding that might have been available. The NHS has a special scheme to pay for residential care for people who have serious and continuing health needs because of a disability, an accident, or an illness. It's called NHS Continuing Healthcare. At the time, Paul and Jill didn't even consider that anyone other than Kath or her family would pay for her care. But 6 years later, they started to wonder whether they should have applied for continuing healthcare funding all along.
It was actually coming to our attention there that Kath's needs were getting greater and greater, and we were starting to question things more. So asked the solicitor to look at the validity of our claim.
The solicitor agreed with the couple that the funding did seem appropriate for Kath, so between them, they pulled together evidence from her GP, from hospital doctors, care home staff and the family itself, and produced an exhaustive report to present to the NHS. They hoped, if successful, that they would be refunded at least some of the care fees Kath had paid for so far. While this retrospective application was being considered, Paul and Jill asked Kath's healthcare team to do a separate assessment for her future care. That was approved, and the NHS funded Kath's care for what turned out to be the last 8 months of her life. And by that point, there was very little of Kath's own money left.
Kath spent £250,000 on her care, £227,000, which is an enormous amount of money for somebody with modest means who'd got, an average semi-detached house.
The NHS gets around 150,000 applications for continuing healthcare funding every year, and the assessments are inevitably very detailed. So it took 3 years for the verdict on the family's retrospective application to come through. And when it did, their claim was rejected.
We were really upset and really disappointed.
I feel frustrated and very angry that my in-laws can't help their grandchildren start their path in life, which is what they would have wanted to do, because every penny of their funds has been spent on Kath's care.
Paul and Jill still find it very hard to accept that, given her state of health, Kath had to pay for so much of her care out of her own pocket.
I know the NHS is struggling, but Kath paid all her life her contributions. I think the NHS should have funded Kath from the word go.
If Paul and Jill can prove that Kath had a primary health need during her time in care, the NHS will still refund some or all of her costs, so they're appealing the original decision. Solicitor Lisa Morgan is helping them to prepare their case.
The NHS acknowledges that 10-15 years ago that people weren't assessed, or if they were assessed, they were assessed far too restrictively and were being denied the funding they were entitled to.
The couple feel that the earlier assessment didn't give sufficient weight to their personal knowledge of Kath and her long-term medical difficulties.
I don't feel that our concerns were taken into account as much as the written evidence.
They certainly should be taking your views into account. The one that we regularly see is where we see in the records that the care home said that, for example, Mrs. Jones is able to communicate her needs. Well, the family say, my mum hasn't been able to communicate her needs effectively for the last 10 years. So it is important that the Commissioning Support Unit do consider the family's views, and especially where there's clearly contradictory evidence.
Because the NHS prioritises current claims for funding, the appeals process can be a lengthy one.
There's a huge emotional and psychological toll on families waiting for that time.
And I agree with you. It is extremely frustrating for us because this isn't a legal process, and it's an informal process. There's no specific time frames that they have to meet.
Well, we contacted the Department of Health, which manages the continuing healthcare scheme, and it said that since it announced in 2012 it would be handling retrospective applications, 59,000 people have applied. And while it says its clinical commissioning groups have been working hard to consider all these cases, it reiterated that current assessments must take priority because these are the most vulnerable individuals. It added that there are just under 8,000 people who, like Paul and Jill, are awaiting a decision on a retrospective case, but it's not possible to estimate how many of those will prove successful until a full assessment has been carried out. Paul and Jill wish they'd applied to the fund from the start, so that Kath's eligibility could have been assessed right away rather than retrospectively. There's no certainty the outcome would have been any different, but Dan Harbour, an independent expert who helps families make a claim, thinks it's unfortunate they didn't have the opportunity. He believes that the reason many people aren't even aware that the funding exists is because not all healthcare workers understand which patients might be eligible.
There are still some health and social care professionals who don't know about it, don't understand it. It is really disappointing when somebody contacts us and tells us they've been in care for a number of years and nobody has ever mentioned NHS continuing healthcare to them.
Dan says cases like this one underline how crucial it is that people wondering how to cover the cost of care know that this fund could be an option. And he's got this advice if you're ever unlucky enough to find yourself in a similar situation to Paul and Jill.
Firstly, be persistent. Don't be put off by somebody who may tell you that you're not likely to be eligible, so there's no point in completing the paperwork. Secondly, do some research so that you know what the criteria are, you know how the assessment will be carried out, you know who will be involved. And thirdly, evidence is all important. This is an evidence-based assessment process. It may also be quite helpful for you to start your own diaries, to just write down a short sentence or two each time you visit your loved one.
Paul and Jill have no idea when they're likely to hear if their appeal has been successful, and as a result they're finding it difficult to move on.
Out of sheer determination, we will carry on, but it does come at an emotional cost to both of us. You know, we have to bring up her death, the most awful moments in her life, when both of us actually want to let her rest in peace and be recalling the lovely person she was.